Very good evening, everyone, guys.
Good evening, sir.
Guys, am I audible? Yes. Good evening. Okay, so Monica, Priya, Kusuma is not there. What happened to her? Mm, Other than Meena is connected, and then Tina, Manju, Hitesh, Rakesh, Shubham, Tamil Selvan. Okay, I think Kusuma alone is not joined. Okay, so discussion. So today we have to discuss the E&M, guys, right? So we have to discuss E&M. So for all the candidates, for all the batches, at last, the last topic we have to cover the E&M. The main reason is whatever still now we are discussing, that is totally different from E&M. Clear? Example, we are discussing surgery, anesthesia, radiology, lab and path. All those services, all those topics, you have to build based on the procedure. So the product performing procedure, you have to code accordingly. But the E&M is totally different because the E&M mean it's not a surgery, it's not a procedure. Normally the E&M mean this is a service,
This conference will now be recorded.
right? So the E&M mean it's a service. For example, E&M, the abbreviation you guys already know. It's called as evaluation and management. So for example, you have the fever. What you will do? You directly go to the hospital and you meet the doctor. So the doctor, what they are doing mean they have to give one treatment, right? For example, whenever you enter into the hospital, first the provider will doing the examination. So what is the problem? What is the symptoms? Everything they have to check with patient. After done all the checking, then based on your problem, the provider given the treatment. For example, they given injection or else they given the medicine, like that they do. So this is called as evaluation and management. And 90 percentage of coding companies having this E&M project. Because the reason why, what does the reason mean? You guys just imagine per day 5,000 patient going to hospital. You guys just imagine all the 5,000 patient they don't go for the surgery. Is it right? So in these 5,000, maximum 4,000 patient they go for only to visit the doctor. That's all. Remaining 1,000 or 800 patient only they are going for surgery or any other treatment. That's the reason we have a number of client in this E&M specialty. That's why if you go with any company, the company having E&M project. So the top companies like Myramid, Ajuba, Omega Healthcare, Access Healthcare. So whatever the top companies like Gibbs Healthcare, Advancement. So like that, all the companies having the E&M project. So the reason the E&M is a very frequent specialty. So that's why. So in this E&M, you guys please note down, we are receiving 6 questions in your exam. We are receiving 6 questions in your exam. Mainly, we have lot of different topics. So we have to discuss all the things today. And one more thing, the E&M code start with 99 series. This one I am already discussed. For example, in your CPT book, the 2 series, the code start with 9. One is the medicine, another one is the E&M. So for example, medicine mean the code start with 909192 like that. And then in this particular E&M mean the code start with 99 series. So this is the difference. Okay. So you guys please note down this introduction, guys. So please note down this and update me, guys. Okay, guys. So I hope you guys are completed. Okay. So the code double nine triple X, right? So the double nine mean it speak about ENM speciality, and the third and fourth digit explain whom the procedure was performed and where it is performed, and the fifth digit explain level of service. Guys, this slide is just an introduction of ENM. So you guys have to know ENM mean what? Under each digit, what is mean like that? So double nine mean it will be denote ENM specialty. Third and fourth digit, it will explain whom the procedure perform and where it is performed. And then fifth digit explain level of service. So this is the introduction. And then whenever you have to code ENM, that time the seven element requiring in your medical report. So what does that mean? In your medical report, we need documentation for patient history, physical exam, MDM, timing, counseling, nature of presenting problem, and the coordination of care. Whenever these seven elements they given in your medical report, that time only we are able to code the ENM. So this is a book guideline. But guys, again I repeat, this is a book guideline. Maybe in future, if you guys attend any interview for ENM, if they are asking, okay, what are the element is required like that, they are asking me, you have to tell all these seven. It is must because we have in your CPT book. But in coding, what happened mean, in coding, we have to check only MDM. So this is a 2023 guideline. You guys clear? We no need history, physical exam, timing, counseling, nothing is needed. Only MDM is documented, we code based on that. This is the coding guideline. Book guideline is seven element is required. Coding guideline is one is enough. We are thinking, sir, we have to follow only book, right? So how we are go with only coding guideline like that? If you have the question mean, guys, overall the provider nowadays they are following like this only. Because you have to code only for provider, right? Provider mean doctor. So all the doctors they have to give only MDM only. So whatever the MDM they documented, you have to code accordingly. That's all. So this is the format we are using. But still, if you guys attending any interview, in that interview they are asking any question. Okay, tell me the element requiring in medical report like that. Mean you guys don't tell only MDM. If you guys are given the answer only MDM, mean that is wrong because as per the book guideline, the seven element is required. That is a general guideline, so you have to give it. So MDM mean medical decision making, guys. MDM mean medical decision making. Clear? That's all. Okay. So these are all the common thing, right? For the E&M coding, common thing. One thing you guys always remember, E&M is not a normal scenario. For example, if you are new to the coding, if you want to code surgery, anesthesia, radiology mean, you guys no need any experience. You guys directly code. If I'm asking question code for appendectomy mean, you guys are able to code. If I'm asking code for hernia repair mean, you guys are able to code. But the E&M is not like that. The E&M, if you want to code very easily mean, you need minimum 1 year of experience in E&M. So you have to understand this. If you guys having 8 months or 1 year of experience in E&M, then only very frequently the codes you have to arrive. But for this exam, this is not possible because we don't have the experience. But how I have to pick the code, sir? Like that mean we have to check few checkpoint. If you guys are following the checkpoint in your exam, you guys are getting answer. So why I'm asking this one mean, normally previously whatever the topic we are discussing, I'm already given. For example, I'm given the homework question like that. So without option also I'm given. You guys are able to code. But the E&M is not possible, guys. Right? Openly we are telling mean the E&M if you want to code mean you need minimum 8 months to 1 year of experience. Then only you guys are able to code. So in your exam, question, if you follow some key point, you guys are arrive the code. So these tricks only you, this is the exam point only, right? If the specialty point mean, that is totally different. You need more experience on that, because E&M we have to calculate lot of concept we have to follow. Mainly whatever the concept you follow, all those concept in your coding company, they given the PDF. So that PDF only you have to follow. A lot of guideline is there. So E&M is totally different. But you guys don't think maybe E&M specialty is tough like that, guys. In coding, E&M specialty also easiest specialty only. But the only one thing is, if you have experience, then only it's easy. Whenever you are new to the coding, if one chart if they are given mean, you will take minimum 7 to 8 hours as a fresher, because you are new. But after getting of experience, one day 150 chart you have to build. You guys get the difference, right? If you are fresher, one chart 8 hours will take. But you are getting experience, one day you have to code 150 180 chart also. So very easy. Once the code will be markup, concept markup mean, each chart 1 minute 2 minute the candidates will complete. Some candidate 200 chart they completing within 3 hours also. So that much easy. Okay, so just to leave everything. Now the exam point. In your exam, after completing all the question, the finally you have to attend E&M. So maximum whenever in your exam you have to attend the E&M, that time you guys having only 10 to 15 minutes in your hand. So what you guys have to learn mean, within the 10 to 15 minutes, if you check what are all the checkpoint, you guys are getting answer. So these tricks you have to learn here. If you apply the key point, you guys are getting answer. So we have to discuss based on that. So please note down, guys, the key points. So this is the key points. Please note down, update me, guys.
Completed, sir.
Okay, guys. I hope you guys are completed. So in this E&M, in your exam, if you want to code, you need to check three key point, guys. One is you have to check new or established patient. The second one is you have to check inpatient or outpatient. And the third one, you have to check level of service. Clear? The first one, new or established patient. The second one, inpatient, outpatient. And the third one, level of service. If you check these three key points, you guys are arrive the code in your exam. But this is the only possible way, because in your exam you guys having only last 5 to 10 minutes or 10 to 15 minutes, that's all. So in that time, if you apply this, you are getting answer. Okay, we discuss one by one. The first one is a new or established patient. Guys, can anyone tell me what is new patient, what is established patient? Anyone having idea?
So when the patient come first time for the visit in hospital for services,
Okay,
and
you
the
guys
step,
clear? So many of them, you guys are in hospital. Yes, established mean
so it's coming for follow up visit.
yes. You guys clear? So nowadays in India also, whenever you go for any hospital, in reception they are asking this question, guys, which mean are you new patient or established? What does that mean? If the patient first time coming to hospital for service, this is called as new patient, right? The patient first time coming to hospital, you consider as a new patient. So established patient mean the patient already seen, now they coming for follow up. This is called as established patient. That's all the difference. Again I repeat, new patient mean the first time the patient coming to hospital, this is called as new patient. Established patient mean the patient already seen, now the patient coming for the next visit. This is called as established patient. That's all, guys. So in your exam also, in your question, first you check whether the patient is new or established. Based on that only you have to go. Okay. So please note down, guys. The new patient. This is otherwise called new patient. This is otherwise called. This is otherwise called initial visit. Initial visit, comma new visit. Initial visit or new visit. And then and then established patient. Established patient mean is otherwise called follow up, follow up, comma 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 f slash u, follow up, comma f slash u, comma established visit, right? Established visit, and then subsequent visit, subsequent visit, subsequent visit, and then revisit, 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 and then return to hospital. That's all, right? So these are all the other name for establish. So this is the first one. So in your exam, Whenever you have to attend the question, first you check whether the patient is new or established. So this is the first point you need to check. And second one, you have to check inpatient or outpatient, because based on this only the code sets will differ. So inpatient mean the patient admit and discharge more than 24 hours. Outpatient mean the patient admit and discharge within 24 hours. This is the difference, right? So more than 24 hours or within 24 hours. Okay. So now I have to show you some code sets, guys. Please note down this. Guys, these code sets only we are using in EnM, right? So please note down this and update me.
Complete, sir.
Okay, guys. I hope you guys are completed. So the place of service. So here I'm given two different type of code sets. One is the inpatient code, another one is the outpatient code. So in inpatient, they're called as initial and subsequent patient. The outpatient we are called as new or established patient. So we have the two different category. Guys, the new, initial, subsequent, established. Everything is same, guys. Just for the difference in your book, they are given like that. But the meaning, everything is same only. Okay. So these are all the EnM codes. So whenever you have to go with the new patient, right? If the patient is new or initial, in your CPT book, you guys having two different set of code sets will come. One is the visit, another one is the consult. You guys clear? Whenever you have to go with new to the new patient mean the patient coming for two different reasons. One is the visit, another one is the consult. So visit and consult both are different, guys. For example, visit mean without any appointment directly we go to hospital and meet the doctor. If this is a visit, it's a common one. But consult mean we need already appointment we need to taken at the same time. The visit mean the general physician is enough, but consult mean we need only the specialist. So this is the difference between visit and consult. So in your CPC exam, compulsory you guys are receiving one question from consult. So please note down the heading consult, guys. Please note down the heading consult. Consult, we need to apply one guideline. What does the guideline mean? The guideline called as triple R concept, guys. Triple R concept. So this guideline is very important. So triple R concept. So now I will give you three R, guys. Please note down. Right? Okay. So first one is the referring. The first R is referring. Right? The first one is a referring, and then rendering, and then reporting, guys. Referring, rendering, and then reporting. So these three we consider as a triple R concept. Right? Okay. So again I repeat, guys, if you want to quote consult mean, in your question you need to check triple R. What does the triple R mean? In your question the provider need to mention referring, then rendering, and then reporting. Whenever these three will be given, that time only you have to quote consult. So what is this 3R? I will discuss. So actually, guys, in India we have the family doctor, right? So same likewise in US also the patient having primary care physician. So they are called as primary care physician. So the primary care physician, what they are doing mean, whenever the patient having any minor problem, for example, the patient having diarrhea, vomiting, fever, like that, the minimal condition mean, these primary care physician will given the treatment. But sometimes, for example, one patient having severe chest pain, they coming to primary care physician. Now, the primary care physician will not given the treatment because they give only the general problem. So now what happened mean, these primary care physician will refer one cardiologist. This is called as first or referring, right? The primary care physician will refer one cardiologist. This is called as referring. Then based on the reference, the patient directly go and meet the cardiologist. So the cardiologist given any treatment or service. This is called as rendering. So referring mean the general physician will refer cardiologist. This is called as referring. Rendering mean treatment. If the cardiologist given any treatment, they do any surgery or examination or ECG, EKG, whatever, if any simple service they performed also, you consider as a rendering. After completing the treatment, the cardiologist send all the report to the primary care physician. This is called as reporting. So whatever the service they perform, everything, the report they have to send directly to the primary care physician. This is called as reporting. Referring, rendering, reporting. Whenever in your exam, the provider documented I am performing consult. So that time you need to check this 3R is given or not. Like that you have to check. In case in these 3R, any 1R is missing. You guys clear? You guys are checking. In that 3R, 1R is missing. That time you directly given the visit code is the default one, guys. Right? If the documentation is not supported to code consult, without any doubt, you directly given the visit code. This is the guideline. But compulsory, you guys receiving one question in your exam from consult. So totally 6 question. From the 6 question, one question from consult. That's all. This is enough. So other than consult, remaining all the code is visit code, guys. Right? So initial mean 992.212.223, and then subsequently establish everything. So now the visit code is the remaining. Okay. The visit code and then consult, whatever, you have to finalize the code based on the level of service only. Right? Previously we discussed, if you want to code EnM, you need to check new or established. Okay, you checking. Inpatient, outpatient. Okay, you checked. Finally, you have to check level of service. Okay. So first I want to tell you the advantage, guys. If you guys are taking exam till 2022, it is very difficult, guys, because till 2022, the EnM level of service you have to build based on three criteria actually. We need to check patient history, we need to check patient physical exam, and we need to check patient MDM. Guys, just imagine what is EnM, because it's happened for you guys also. For example, you are the patient, right? You just imagine you are the patient. You have frequently 3 days you have the severe fever. So as a patient, you are going to hospital and you meet the doctor. So whenever you have to meet the doctor, first provider what they are asking, okay, tell me what happened to you. Like that they are asking. So you said entire history, past 3 days, whatever happened, you guys will given to the provider, right? For example, so 3 days before starting fever, I'm getting vomiting as well as, so I'm having this type of problem, headache, like that I'm having. Okay, the provider asking, okay, in history you have any COVID or you have any injection, like that they are asking about the history detail, everything. So you inform all the things. So when it is come and what is the problem and what is the pain you have, what is the symptom you have, everything you are informing to the doctor. So this is called as history. After you said all the thing, what the provider do, guys? The provider will checking in stethoscope, right? Okay, so breathe down, like that they have to examine you. This is called as physical exam. After done this examination, then in that bill, I hope you guys know, all the hospital, the provider having some paper, right? So the medical paper, so they have to mention, okay, the patient having viral fever, So you just take blood count, platelet count, RBC count. Like that, the lab test they will order. If the patient said, "Sir, I'm having severe cough," so like that mean okay, you just to do the X-ray. So like that, they order, right? So some of the lab test and then the radiology they are order. After that, the medicine they will prescribe. Okay, you will take this medicine and you will take this injection. Like that, everything they given. This is called as MDM. That's all, guys. It's daily basis. Whatever happens, same. Whatever problem you have, you inform to all the thing that is called as history. The provider will be checking you with the stethoscope. That is called as examination. After done that, the provider order lab or radiology or whatever needed along with injection medicine like that they given, that is called as medical decision making, MDM. So this is called as ENM. So previously till 2022 we have to check all the three. In history we have 4 level, physical exam you have 4 level, MDM you have 4 level. So we need to check all this level and you have to code. But from 2023 you guys are very lucky, because what is the advantage we have mean, in your exam maximum they directly given the level. Your only work, which level comes under which code, you check and code accordingly. That's all, that is enough. Before discuss this, please note down the level of service, guys. Please note down the level of service. In MDM we have 4 level, guys. In MDM we have 4 level. Please note down, guys. The first one is straightforward MDM. Straightforward MDM. And then second one is low MDM. Low MDM. And the next one
Sir,
is
sir, can you please repeat
yeah,
last
the
one?
first one is the straightforward MDM and then low MDM. Low.
Okay, thank you, sir.
Yeah, okay. And the next one is moderate MDM. Moderate MDM. Moderate MDM. And then last one is high MDM. Right? So once again I repeat, straightforward MDM, low MDM, moderate MDM, high MDM. So we have in this particular 4 level in MDM. So whenever in your question the provider directly given the level, actually the level we need to arrive mean, that's why we said we need to follow lot of things. So mainly we need minimum 1 year of experience. So that's the reason in your CPC exam they directly given the level. So what you guys will do mean, whatever the level they given, you guys directly go with that level. For example, you guys see the screen. You guys please see the screen. Yeah, so this is the ENM codes, guys, right? This is the ENM code. See the first code 99202, they given straightforward MDM. See, straightforward MDM they given. And the next code is 99203. They given low MDM, and next one is for 99204, they given moderate MDM, and the last code 99205, this is they given high MDM. So in case in your question the provider documented I am performing high MDM, like that they mention me, you guys without any doubt directly you give 99205. That's all guys. So that's why I said nowadays it is very easy. So directly they given the level. You just check which code below that the level will come. So you have to check and you code accordingly. That's all. From 2023 only we have to follow like this. If you before mean we need to follow a lot of guideline, but now this is very easy guys. Clear? Okay. And one more thing, still now whatever we are discussing, from this you guys are receiving only two questions guys. This is called as basic EnM. In your CPC exam, all the question we are not receiving like this. Only two question. Remaining question you are receiving from critical care, ED, preventive medicine, like that topic wise. So those question within a minute you are getting answer. So this is the concept for EnM. So whenever you code EnM, you guys just to check. For example, patient is you are established, and then you have to check the patient inpatient or outpatient, and then you have to check based on the level of service. If you guys are checking these things, you guys are getting answer very easily in this EnM. So directly they have to give a level. So based on that you have to go. Here guys, that's all. But still now whatever we are discussing, this is just for your two question only. You guys are receiving only two questions from this. Clear? Okay. So and one more thing guys, one more thing I want to discuss. Normally, right? So normally, just I don't know, is it helpful for you or not? But just I'm given you the hint, right? Maybe if they are not won the level, for example, guys, it's not happen. But just I will tell you, maybe if you are attending one question, in that question, the provider will not mention the level. Now, how easily I have to get the level? So I will just give you one hint. So maybe this one also helpful for you. So please note down, guys. If you want to give high level MDM mean, if the provider given any prescribed drug, you guys please note down. If you want to use high level MDM mean, if the provider given prescribed drug, the drug prescribed like that, the drugs anything they prescribe, you have to consider it for. You have to consider it for. Sorry, the high mean I am just to go with high to low, guys. So please note down. If you want to quote high level mean, if the provider order any major surgeries, right? If the provider order any major surgeries like that, if any documentation we are receiving, you guys directly consider as a high level MDM. Clear? So major surgeries mean you consider as a high level MDM, and moderate level mean prescription drug. So please note down, moderate level mean prescription drug is documented, you have to go for moderate. And low mean the provider order any oral drugs. So normal oral drugs or any topical drugs, anything the provider order, you consider as a low. So major surgeries, anything order mean, you consider as a high. Prescription drug, anything they order mean, you consider as a moderate. If oral drug or else the topical drug, anything they given, you consider as a low. And straightforward minimum is very minimal, guys. The provider nothing will do. The patient coming for fever, okay, just the provider will be given some normal medicine like that. So the scenario, the straightforward, if you want to code mean, in your report nothing is documented. The provider did not do any service. That time only we go for straightforward. So all this just for your knowledge purpose I have to share. Right? That's all. So this is called as EnM. So overall 6 questions you are receiving in your exam. In these 6 questions, 1 question you're receiving from consult and 2 questions you're receiving from EnM, which means whatever still now we are discussing from this topic, you guys are receiving 2 questions. And the next topic, everything we have to build based on the topic wise, guys. Right? It's very interesting only. So please note down the next topic is critical care, guys. So please note down the next one is a critical care. So critical care, we have only 2 code, guys.
Sir, sorry for interrupt.
Yes.
Sir, actually I have one question. Suppose I got in TX part, it's low, okay,
Okay.
and data point I got in moderate,
Okay.
and risk point I got high. So in that
No, I did
scenario,
not.
what I will
No, I did not understand what you said.
actually after checking, suppose there is mentioned DX diagnosis part. Okay,
Okay.
problem part they mention it's a low.
Okay.
Okay, and
Actually,
data review.
this is the internal one. So we have that 3 box, right? So A, B, and C. So A is very minimal, and then the B, the lab test, whatever they given, that is moderate, and then the prescription is high mean. You go for the minimal, medium level. The second highest you have to go.
Okay, that means 2/3, right?
2/3 like that.
Okay, okay, sir.
Yeah. Okay. So the critical care, we have 2 codes, guys. One is the 99291 and another one is the 99292. You guys see the screen? So this is the critical care. So this is the critical care. Very simple. You have to code based on the timing. The provider documented the timing. Based on that, you have to code. For example, 30 to 74 minutes and then more than that, like that. Guys, sometimes if you have luck in your exam, you are receiving 2 questions also in your exam from critical care. If critical care question you are receiving in your exam mean, you guys nothing will do. Directly go to this page and before this table you have to go. That is enough. Because in this table already they given for this hour, this minute, what code you have to use like that. You guys see the screen and tell me if the provider documented 1 hour 30 minutes critical care timing. So what is the answer you have to give? Check and tell me, guys.
Sir, 99291 into 1 and 99292 into 2.
That's all. So 1 hour 30 minutes mean 99291 and 99292. That's all. Okay, in case the provider documented 170 minutes, what is the answer?
So 99291 and 99292 into 4.
That's all, guys. So nothing you guys will do. Whatever the timing they documented, you have to code accordingly. That's all. You guys clear? That's all, guys. So nothing you guys will do. Whatever the timing the provider documented, you have to check and you have to code accordingly. That's all. So from critical care, the time based question, one question you are receiving in your exam. And the next one is a, please note down, critical care included service, guys. The next one is a critical care included service. So now I will give you some of the services. If the provider perform critical care along with any one of the service performing, you code only critical care. This is the concept. Okay, so please note down one by one, guys. The first one is chest X-ray. Chest X-ray. The next one is pulse oximetry. Pulse oximetry. And the next one is gastric intubation. Gastric intubation. And the next one is ventilator management. Ventilator management. The last one is vascular access procedure. Vascular access procedure. So these are all the included service. So if provider perform critical care service along with any one of the service, mean you code only the critical care, don't code the service separately. That's all, guys. So this is for critical care. This is for critical care. That's all. So you guys having one or two questions from this critical care service. So hereafter, whatever we discuss, it's a very minimal, guys, right? So it's an easy topic only. The next one is a emergency department, guys. The next one is a emergency department. It's otherwise called ED, right? This is for ED code. Okay. So ED mean you have only 5 code, guys. Please note down the code. The code is 99281 hyphen 99285. 992812 99285. So this one also you have to code based on the level only, right? So the high or moderate, whatever, based on that only you have to build. Actually, the coding we don't have any guideline. We just leave that. But in this ED, we have the guideline, right? So we have some guideline in this particular ED department. So I will discuss one by one the guideline. The first guideline is for the ED department, you guys don't check primary or secondary, guys. Clear? For the ED department, you guys don't check primary or secondary, because all the ED codes, it's a sorry, the ED codes you don't check new patient or established patient, because all the patient we consider as the new only in this ED. This is first guideline. And second guideline is the second guideline is if critical care service performed in if critical care service performed in ED department if critical care service performed in ED department, you have to code only the critical care service, guys. You guys clear? Guys, this is very important guideline. If critical care service performed in ED department, you have to code only the critical care service. And last guideline, last guideline, the last guideline is if the patient admitted in right, if the patient admitted in emergency room and then admitted to and then admitted to then admitted to inpatient setting, then admitted to inpatient setting, you have to use inpatient codes only. You have to code inpatient codes only. Again I repeat it. First the patient admitted in emergency room. After that the patient moved to the inpatient setting. Now you have to code only the inpatient codes only. Clear? For example, sometimes it happen. The patient having severe abdomen pain. So the patient admitted in emergency department. After checking the patient, the provider getting the patient having appendix, right? So the rupture appendix. So it is very emergency. So provider what they are doing mean, for the surgical concern, they admitted the patient in inpatient setting. So now you have to bill only the inpatient codes only, right? So first admitted in emergency room, then move to the inpatient. So now you have to code only the inpatient code. That's all, guys. So this is the guideline you need to follow in this particular emergency department. Clear? That's all. Then the last one is preventive medicine, guys. The last one is preventive medicine, right? The last one is preventive medicine. So the preventive medicine, please note down the code sets, guys. Please note down the code sets. So 99381 hyphen 99381 hyphen 99 99381 hyphen 99387. So this is the code sets for preventive medicine. Right, I'll show you. So see, this is the preventive medicine, guys. So the preventive medicine mean, this is otherwise called annual wellness visit, guys. This is otherwise called annual wellness visit. Okay. Annual wellness visit. So please note down the key point, guys. If two key point, if you are checking, you are getting answer. The first key point is you have to check new or established patient. Right? You have to check new or established patient. And then second point, Second point, you have to check patient age, guys. You have to check patient age. That's all, guys. So these 2 points, if you are checking, you are getting answer. Okay, you guys see the screen. The first code, new patient. The code will differ based on age, guys. See, younger than 1 year, 1 to 4 year, 5 to 11 year. Then same likewise. Then established patient. So the established patient also, based on the patient age, the code will differ. That's all, guys. So preventive medicine, you guys no need to do anything. Just to check your question, what is the patient type, and then you check whether the patient is, what is the age. That's all, guys. So these are all the things you need to check to code ENM. And one more thing, in ENM, we are using one modifier. The modifier is called as 25, guys. Right? This modifier is very important. So when we are using this modifier mean, if same day, roader perform ENM service along with any procedure. If same day roader perform ENM service along with any surgery, that time you need to use modifier 25. So this is the only modifier receiving in your exam. So that's all about ENM, guys. So after completing all your assessment, finally you guys will attend the ENM assessment. And in your exam also, same. After completing all the topic, you will do the ENM because it will take time. So in starting, you are started with the ENM mean you guys are getting lot of time. So please plan. So that's all about ENM, guys. So hereafter only the main challenge will be started. So in your free time, you guys please do all your assessment. And candidate who are all planning your exam in April, please message me. We have to plan your exam accordingly. That's all, guys. So thank you everyone, guys. All the best for your exam and interviews, guys. Thank you everyone.
Uh, hello. Hello.
Thank you, guys.
Sir, one
Yes.
more thing I want to ask. Sir, just I want to ask if the in the document not mention new or established, so by default we will go on establish or new
No, new.
on new.
But maximum they given new or if there is no document, we go for new is the default one.
Okay, sir. Okay, thank you.
Yeah. Okay, guys. Thank you everyone. Bye, guys. All the best.
Thank you, sir.
Thank you, guys. Thank you everyone.
Thank you, sir.
Thank you, guys.